And welcome to our August Lunch and Learn. August is National Immunization Month. So we have two very special guests here. They're going to be talking about immunizations in general. We have Dr. Hamdan here, and he works in the family practice in Geneva, and Dr. Sam, who you know because we have him on all the time.
Oh.
He's one of our pediatricians here
That's
at ACMC.
part of my job to be here.
So I thought I'd start just with Dr. Hamdan, if you want to talk a little bit about yourself.
Yeah, absolutely. Thanks for having me. So I'm a family medicine physician. I work at the Geneva Clinic out in Geneva. So I'm there as family medicine. I see, from 2 and up. So I see children, adults, all types of patients.
Awesome. Thank you. Dr. Sam?
Hello everyone, I'm Dr. Sam. My full name is Sampurna Shakya, but everyone in the community knows me, also in the hospital knows me as Dr. Sam. I'm a pediatrician at Ashtabula Clinic, and I started from 2020, so I've been here for a little bit more than 2 years now. It's been a very good experience. I see patients from newborn babies till they're like 18 to 20 years of age until we find them transition to the adult side in family medicine or internal medicine. So I'm very excited to be here today to talk about the vaccines.
Okay, great. So I did a little research before.
Good.
When I went online, I saw the immunization schedules for children and for adults, and they're pages long, and I was just overwhelmed. So I thought this is a great topic to start. So just to start off, Dr. Hamdan, a lot of questions that we get, or that I even saw on the website, was why do we need vaccines? And have you ever heard, haven't we gotten rid of most of the diseases in the U.S.? Why do we still need these?
Yeah, excellent question, especially, with everything going on with COVID right now. So, I'm a firm believer in preventative medicine, and that's preventing something before it even gets bad or occurs. So fortunately for us in medicine, vaccines are another way of preventing something from happening. So just basic science, what vaccine is, it's basically a component of a substance that's introduced to our bodies that allows our defense system to be activated, also known as our immune system. So we have a special system. I always use the analogy of like war. Mm-hmm. So, our body creates an army that helps recognize certain infections that could be virus as well as bacteria. So that way, if, we are exposed to these things in life, our body's ready to fight them off. And a lot of times, if the immunity is built, we don't even know it if we're fortunate enough, and we don't even get sick. Mm-hmm. So vaccines are very important. They help, prevent sickness. And another part of your question is, haven't we gotten rid of most of the diseases in this country? So the truth of the matter is, a lot of these vaccines, we don't even really hear about these infections anymore. But back in the time, there were crazy health crises where there were plagues and a lot of people died. For instance, like polio and other infections that we still vaccinate for, but we still don't hear about. And right now, with COVID and everything, it's such a unique time because we're literally learning about a new infection, the vaccine process, and we're constantly adapting. And I'm sure we'll talk about that in more detail as well.
Well, speaking of COVID, Dr. Sam, what are your recommendations for when your child should get a vaccine, for the COVID vaccine?
As soon as they can, and that's the CDC has recently approved, given authorization for children above 6 months to get vaccinated. This was 2 months back. They approved it for 6 months to 4 years. Prior to that, it was already the children from 5 years onward were already authorized to get the vaccination. So the recommendation is to get it as soon as they are 6 months old. And the vaccination, the dose depends on the type of the vaccine that you're getting. As you know, there's like Pfizer, Moderna. There's a new vaccine called Novavax too. So the recommendation for the scheduling of the vaccine differs, but the answer to the question is as soon as they can, and that is 6 months.
Okay. And then Dr. Hamdan, for the adults, we get a lot of questions. Should I get it? Do I need all these booster shots? Because now there's 1, there's 2, there's 3. Like, what do you recommend for adults?
Yeah, so I mean, vaccines are recommended generally across the board, especially with COVID. Unfortunately, we've seen a lot of, death tolls. And so I think all adults should get vaccinated. The COVID vaccine, the primary series consists of two vaccines.
Mm-hmm.
You have the Moderna as well as the Pfizer, as Dr. Sam mentioned, which we recommend you complete the series usually within 3 months. And then after that, like 4 months is recommended to start the booster series.
Mm-hmm.
So the booster is sort of exactly what it sounds like, kind of boost the immunity, the defense system, to stay active, to continue fighting for you. And these vaccines have been shown to lead to less serious complications that we've seen in adults, especially those at higher risk, like that are, patients that smoke, obesity, or other comorbidities as well.
Also, to add up on that, like when we get the vaccine, over the time, the effect of the vaccine wanes off. It wanes off. So to prevent from your system not having any immunity left against the vaccine, you need to boost the immunity by constantly, introducing the vaccine.
So do you recommend that we get the COVID vaccine every year? Or we don't know yet?
We don't know that yet. That is something for the future.
Okay.
But right now there are certain, like let's say the first booster dose, just like how we said, after 4 months of the last second dose, you're eligible to get the booster dose. And there's also the second booster dose also for people who are immunocompromised or have some like chronic diseases. That's for the adults as well as for in the pediatric population too.
Well, Dr. Hamdan, speaking of vaccines, when I was doing my research, there's a lot of vaccines that adults need that they might not realize that they do. I mean, what are some types of vaccinations that you wouldn't think that you would need to get every year, every other year?
Yeah, so again, fortunately, due to science, a lot of these diseases we don't even hear about, but per CDC guidelines, they're all highly recommended. So some of the vaccines that, I discussed with my patients, for instance, meningococcal, are constantly given, and people don't even know what it's treated for. So I always explain to them meningitis, which could be a very serious infection that involves the brain, can be prevented with this meningococcal vaccine. Tetanus, diphtheria, also a very important vaccine. So this is something we don't really hear about, but back in the day it was very common. But tetanus, especially for my patients that are in the industry with nails or rust and can step on nails or receive any type of cuts, tetanus can be protected with this vaccine as well in serious complications.
Also adding to that, in pediatric population, like let's say, also the moms who have not gotten pertussis vaccine, or over the time when they're pregnant with their baby, they also get Tdap. Mm-hmm. So they also get vaccinated for pertussis too, because you don't want to give that to the kids.
Right. And then speaking of children, we get a lot of questions too about not only what types of vaccinations I should give my child, but when do you start? I have lots of questions on that. But what vaccinations do you have to have?
So the CDC, per CDC guideline, as you can see, that's like a laundry list over there. But those are, what I want to say is those are all highly studied vaccines under the FDA guidance. And for it to get approved by FDA, it has to undergo that much of study as well as experiments looking at the adverse effect and all those things. So these are like highly studied vaccines. And the schedule that we have, like some kid will get it at like birth, there's some for 2 months, 4 months, 6 months, at 1 year of age, 15 months, 18 months. So there are like so many vaccines that you get. And the reason that we give it during that duration is because it has been studied when the first vaccine that you get when it starts waning off and when you need the booster. These are all studied. That's why they are given at a certain time period. And as you can see, like there are so many vaccines, namely like there are like about 14 or 15 that CDC recommends. If you look at the list over there in the United States, some of the vaccines you get like multiple times to maintain that level of immunity in your body, also to have the full dose of the vaccine.
Okay. And then some questions that we get are, if my child isn't feeling well, should they get the vaccination or should they wait?
Yeah. What we say is like every appointment is your opportunity to give vaccine to the child.
Okay.
Any appointment, but sometimes we also have to look at the comfort level of the parents, because as I always say, it's a combined decision making. You are helping, rather than saying to the parents, hey, the child needs this vaccine, rather than that, why don't we do like, hey, these are the vaccines that we should give. Are you comfortable giving it today? Sometimes my recommendation would be, if the child has like just a runny nose, mild kind of infection, yes. If the child is supposed to get the vaccine, yes. During that time, I would give the vaccine to the child. But if the child is very sick, and on top of that, the parents are not very comfortable giving the vaccine that day, but they would want to do that like after a couple of days, then yes, we should work it out among us. It's a shared medical decision making for to make sure that the child is well protected. So yes.
So Dr. Hamdan, I would assume the same would be for adults. If they're sick, should they wait or?
Right. I mean, depending on the severity, as Dr. Sam mentioned, it's always recommended. I try to refrain if they do have a high fever. I'd always try to bring them back once like an antipyretic is used to kind of get them down, or they're a little more stable. But absolutely, every opportunity that we can get, they are highly encouraged, recommended. So,
Dr. Hamdan, what are some common side effects? I think people they're always worried about.
Yeah, very good question. So some of the common side effects include fever, muscle aches. A lot of times there's a little bit of soreness, especially at the site of injection. So a lot of times we provide supportive management when I give my vaccination. So I will tell the patient, you can use a cold pack at the site of injection. You can even do arm exercises. I always try to recommend to get the vaccine in the non-dominant side as well. That way muscle aches or pain is not felt as much. And of course, there's always the recommendation of antipyretic use for fever, aches, which includes, Motrin, Tylenol, or aspirin as needed. But usually these side effects are very minute. They usually last and resolve within a couple days.
Okay. Dr. Sam, pretty much the same.
Yeah, pretty much the same. Usually because it's given intramuscular, so it takes a couple of days for that medicine to slowly get absorbed in the muscles. So the child might feel a little bit sore in that site of infection, site of injection, and also they might spike a little bit of fever, because what happens is when you give the vaccine, your body tries to fight back against the vaccine.
Okay.
And this is more pronounced when you get like second or third dose of the same vaccine, because your immunity already knows, your body defense mechanism already knows that antigen that you're giving, so there will be more immune response. And actually that's how your immunity works. You fight back against the disease, you create a memory cell, that's how you develop the immunity. So having fever, feeling a little bit like, tired the next day is completely normal and part of immunologic response to the vaccine. So we just educate the parents if they already have 3 or 4 kids. We usually don't need to, but we still should. But usually the new parents, we should always talk about like these are the things, like we give the anticipatory guidance, like these are the things you might expect, and you can use Tylenol if there is any fever, or if the child is very fussy, then you can use like Tylenol. Definitely, cold compression also helps.
Right. So we talked a lot about young children and adults, and this is a question can be for both of you. What types of vaccinations do like adolescents need? In their teens. Yep. Like, a lot of people think that once my kids are out of kindergarten, then I don't have to worry about it anymore. But
exactly. So at 11 years of age, they come for their physical and they need like a couple of vaccines, namely the booster dose of tetanus, including pertussis and diphtheria, also we call it Tdap. That's one of the booster dose. Plus, they will get new vaccines like human papillomavirus vaccine and meningitis vaccine. That's the vaccine that you get when they're in the adults, and there are like, so human papillomavirus is 2-dose vaccine.
HPV, also known as HPV.
HPV or Gardasil, more commonly the trade name. So you get that human papillomavirus vaccine to prevent anogenital warts, to prevent the cervical cancer, which is #1 cause of cancer in the females. Previously, it was given just to the girls, but later on they found that it prevents from the males can also have like penile cancer, throat cancer, anogenital warts. So they start giving it recommended it to like the males too.
What if they don't get it? Like, do you get that as an adult later, or is it just something you get as a teenager?
Yeah, preferably teenager. But if they've not gotten it and later on they want to, we can still give it. But the number of doses might differ. Before 15 years, it's 2 doses. After 15 years, if you start it, then it's a 3-dose series.
Okay. And then, since we've talked about all age groups, we didn't really talk about seniors. Dr. Hamdan, do you want to talk about some vaccinations that senior citizens should have? What age?
Yeah, so definitely, as we age, our immune system also becomes slightly compromised, so it's very important to continue getting vaccination because there's a higher risk. So, for instance, the pneumonia vaccine at the age of 65 is highly recommended just because, God forbid, elderly patients are more likely to get pneumonia. And pneumonia is basically an infection of the lungs, which as a senior citizen is, God forbid, if they were to get this infection, the complications are much more likely to be severe versus a younger, healthier individual, especially in our smokers that are also older. So yeah, absolutely, still important to continue these vaccines moving forward. Also, around 50 years old, there's the shingles vaccine, which is highly recommended. Shingles is it's a virus that usually leads to a very painful vesicular, which means like bubble-like cluster rash that presents itself in like a dermatome fashion. It can be very painful, and the elderly population is more prone for that. So it's always recommended to get those vaccines.
So after 50?
Yes.
But then do you have to get it every year or just one time?
No, one time is a 2-dose vaccine series, which we usually have one, and then 2 months later we give the second dose.
So like, is it similar, maybe Dr. Sam, you can answer this, is it similar to like chickenpox when you were little? Or?
Yeah, yes.
So
Exactly.
do kids still get chickenpox the same as they used to? Like I remember when I was young, it was horrible. And like when my kids had it, it wasn't nearly as bad. So
Yep. Over the time, the effect of the disease also differs. But yeah, chickenpox. So this is the thing. There's something called natural immunity which you get by getting the disease. So let's say somebody who gets chickenpox develops immunity against the virus. That's a natural immunity. But if you give it through the vaccine, you're like trying to create the immunity. And that is also part of like discussion among the parents. Why not like natural immunity and all those kind of. But with natural immunity, you have to think about all the complications. We always talk about these 3 Ds: disease, disability, and death. Right? So there can be lots of complications with these diseases. Like with chickenpox, you can get, you name it, you can get anything: meningitis, brain infection, plus really bad chest infection, really bad gastroenteritis, or sometimes like in the testicles too, they can have like a lot of different kind of disease in there, so they can cause a lot of different problems.
So you definitely should get it. And like I would, like when my kids had it, the parents used to be like, well, we want our kids to get it. Let's get all our kids together so they can get it. I'm like, that's probably not the right thing to do, right? Okay,
not the right thing to do. Not the right thing to do. Also, it also depends on if let's say somebody never had chickenpox vaccine, plus they never got chickenpox, and you're talking about like, let's say these teenagers or in their 20s, if they get the chickenpox at that time, these are even more complicated. And Dr. Hamdan can tell you more about that, right?
Yeah, right. As Dr. Sam said, the earlier the better. Allows that immunity to develop, therefore decreasing the risk of the severity and the complication, which is likely, as we're older, as he said. So there's two different immunity systems. There's the passive one, as Dr. Sam said, that's actually getting the virus naturally and then creating the immune system.
Yeah.
And then there's the active system through the vaccines, which, as Dr. Sam said, it's more likely to prevent something versus waiting and having something serious happen if he did get the bacterial or viral infection.
Now, we've heard a lot in the news about this new monkeypox. Can you give us some information about that?
Yeah.
Either one of you.
Monkeypox. I mean, it's in
It is
the
a thing.
rise. The WHO has already declared this like a pandemic too.
Okay.
As much as because I have not seen the case, but there are lots of cases reported all over the world, and there's actually a vaccine also for monkeypox. Yes, it has been seen in whole different kind of populations, from children to like teenagers to middle-aged people to older people, also elderly people population, and it can cause a lot of complications. Presents as skin rashes, but they can have lots of like cardiopulmonary complications later on.
So neither of you have seen any cases here?
Not yet, knock on wood, okay? Knock on wood, yeah.
Okay.
But yeah, I mean, monkeypox, just like, unfortunately, there's going to continue to be different types of viruses and illnesses that we're going to hear of, unfortunately. Because what happens is, I know I'm kind of getting ahead of ourselves, but we were going to talk about it, is these infections, the bacterial, the viruses, they continue to adapt. So they will evolve through time, and that's why we hear about these new viruses, these new illnesses, or different variants. I'm sure that's a very common buzzword we've been hearing of these different variants. So what happens is, these infections are smart. They start to learn, they start to recognize how they can still be effective and cause harm. So that's why you'll hear about these new viruses, and a lot of times they actually stem off pre-existing viruses, bacterial infections and illnesses. And hence the reason why we constantly have to adjust these vaccines and continue with these boosters to constantly be ready to fight.
All right, so if anyone watching, if you have any questions, if you want to type it into the comment box, I will make sure to get those questions to Dr. Hamdan and Dr. Sam and get those answered for you. In closing, is there anything that you both would like to, as a closing takeaway? Or?
One of the common things that I constantly get in the clinic would be people ask about when we give MMR, chickenpox, MMR vaccine, they talk about, is there risk for autism? So that is a very common question that we get in our clinic. And let me start by saying that it's a hoax. It's not true. Okay. There has been no scientific study that linked association between autism spectrum disorder and MMR vaccine. Previously, in 1998, there were a couple of providers who reported this association, but when they did the study, when they looked into the report, it was a fraudulent report, and ethically also it was wrong. There are lots of details into that, but in summary, what it means is there has never been shown any association between the MMR vaccine and autism spectrum disorder, including the preservatives. There was something called thiomersal preservative that people talk about, associating it with high mercury exposure and leading to autism spectrum disorder. But MMR never had that thiomersal, that preservative in it. And also they've studied thiomersal, that preservative too. There's no association of that component in the vaccine, which is like a preservative, and that has no association with autism spectrum disorder. Okay. So just wanted to let the community know about it. All these vaccines that are CDC recommended these are all highly studied vaccine in terms of safety, and also want to let you know that all these vaccines that we're still giving, they're constantly monitored. There's like a vaccine safety. There are a group of scientists who are constantly getting feedback from all the providers, all these health institutions about this vaccine. If there's any side effect reported from the vaccine, it has to be reported by the provider. It's mandatory. Ethically, it's mandatory. And the vaccine adverse effect response system, which is we call it VAERS, they're always constantly monitoring the side effect and all those things in each and every vaccine that we give to the kids. So it's highly safe. Yeah.
Any closing thoughts from you, Dr. Hamdan?
Yeah, I mean, just to piggyback off what Dr. Sam said, overall the benefits definitely outweigh the harm. There are the rare side effects that may occur, such as allergic reaction or anaphylaxis, but very rare. Seldom do they occur. And as he stated, there's agencies that constantly monitor any type of adverse side effects and mention any type of increased risk factors with any of them. And essentially, I mean, that's what medicine is. Medicine is based off of studies that have taken place and the benefits, the harms, and overall the decision making is made off of the science. And overall, vaccines have helped us maintain, large populations that we have, and a lot of people don't even know about a lot of these illnesses that we don't even deal with, fortunately, nowadays.
Great. All right. Well, thank you both very much for participating. We will definitely put the links on the comment section to allow you to reach one of these physicians if you'd like to make an appointment. I will also put these things that I found on the CDC, links to these, so you know. But again, thank you very much for participating, and thank you for joining us for our August lunch club. Thank you.
Okay.